at the end. Which leads us to our topic today. We are here to talk about postpartum depression. I'm joined by two wonderful individuals to discuss identifying signs and symptoms, seeking help, what diagnosis and treatment can look like, and building a strong support system. We want to thank Sage Biogen for making this webinar possible today. And before we hear from our speakers, I want to uplift a couple resources for our audience. These will be included in all of your follow-up materials so that you can access them. We have some great affiliates from MHA doing wonderful work in these areas that I want to uplift. MHA of Ohio and the Mental Health Association of Maryland are leading the way in promoting perinatal mental health, especially postpartum depression. MHA Ohio has initiatives like POEM and POEM Rise, which provide peer support and culturally responsive care for marginalized communities. The Mental Health Association of Maryland is promoting Healthy New Moms, an outreach program educating new mothers on perinatal depression. Today, we're going to discuss the importance of education, breaking that stigma, having a strong support system, all things that these programs are looking to address. I know I saw people putting in what states they're from, and in Maryland and Ohio, if you're from one of those areas, check out these resources. I'll be sending them in your follow-up materials and get connected with those MHAs. Now, I am delighted to introduce our two speakers for the day. We have Dr. Lithinia Baker, who specializes in obstetrics and gynecology, and Andrea Clark, who is the Deputy Chief Executive Officer and Director for Alliance for People of Color Postpartum Support International. We are thrilled to have each of you joining us here today. I would love to start off by each of you giving us a little introduction, a little bit about yourself so our audience can learn about you and what you're bringing to today's conversation. If we want to start out, go for it, Andrea.
Okay. Hi, everyone. I am so glad to be with you all today. Thank you to MHA for the invitation. I am, as Jackie mentioned, I am the Deputy CEO and the Director for the Alliance for People of Color with Postpartum Support International. And we are an organization that provides peer support, but also does advocacy and provider education and training around perinatal mental health issues. And so my particular passion is for doing that and uplifting the ways that perinatal mood disorders affect communities of color differently, and how to be culturally responsive in our approaches to caring for traditionally marginalized communities.
Thank you, Andrea.
Fabulous. Oh, yeah, so excited to join you guys today. I am Dr. Joy Baker. My first name is Lithinia, but I go by Joy. And I am an OBGYN practicing in LaGrange, Georgia, so sort of an under-resourced setting. Several years ago, I actually got additional training in perinatal mental health through PSI. And so I hold a certification in perinatal mental health, and I've done a couple of studies on how we can think about this and in terms of screening, referral to treatment, and support for families who are dealing with postpartum depression or other perinatal mood and anxiety disorders. So I'm so excited to join this super important conversation.
Absolutely. Thank you both for joining us. I kind of want to take us with our discussion through the process of how we can identify postpartum depression, what the signs and symptoms are, how to notice someone might be struggling, then into this, what can treatment look like? What does support look like? So kind of taking this journey for the next hour together. So I would love to kind of start by hearing from each of you of what are some of those most common signs and symptoms of postpartum depression that women and loved ones should be aware of?
Well, I would jump in and just say that there are several signs. And while we think about postpartum depression, we should also think about perinatal depression and anxiety, because it can start during the pregnancy. It can start in preconception with folks who are starting their journey in trying to conceive. So we have to think about that full spectrum of time and thinking about how to recognize when someone is really struggling. So if they're sleeping too much or not sleeping at all, if they're eating too much or not eating enough, if they don't find pleasure in things that they used to really love, if you've got someone who used to love to go to the football game and now you can't get them to even look at a football game on television, when we lose that pleasure, the thing with the things we enjoy. Also, we should think about the fact that some of these perinatal mood and anxiety disorders can present as irritability. So when I'm seeing patients who are alienating themselves from their partners, from their families, they're just really kind of irritable and snappy. I think that's also a place we should explore. If we have folks who are spending most of the day tearful, during or after pregnancy and just having a hard time, there's so many different signs and symptoms. And so we sort of just have to be on watch, right? Screening to me is one of the most important things that we should be doing. And there are lots of online tools that can be used to screen that don't really require a lot of clinical skill. So I think we can certainly have those take over. Just be checking in with folks. How are you doing? How are you doing emotionally? How are you doing mentally?
Yeah, I'm so glad, Dr. Baker, that I think someone put in the chat comments that you talked about the perinatal period, right? So that's anytime from conception through the first year after delivery, right? And so we all hear about the baby blues and how because a woman's body is readjusting after having the required hormonal changes that happen in a body when you're carrying, I should say birthing person, not just women, but when you're carrying a child. So there's an expectation that there may be some mood differences after delivery, right? But if those mood differences extend beyond the first 2 to 3 weeks after delivery, if you're noticing some of those same things that Dr. Joy was talking about, this consistent irritability, the change in appetite, right? Like either you're eating too much or you're not eating enough, that lack of motivation. I think irritability also presents a lot, especially in patients of color. I'm also a pre-licensed clinical therapist, so I'm getting my PhD in clinical therapy. And a lot of times, with depression in general, in women of color, it will present as this sharpness, this irritability, and not even really knowing why I'm feeling so snappy with everybody. Um, it might present as that before it presents as sadness, and we typically equate depression with sadness, but that irritability is definitely one. And then also for folks of color, somatic symptoms are big. So, are you having unexplainable headaches? Are you having stomach trouble? Sometimes it presents as low back pain. And part of what makes this hard to discern in women in the postpartum period is because a lot of those symptoms, as you're recovering from, from delivery, um, can be things that are quite normal. But those are things that I think if they're consistent and they're very unusual, whether or not you think, oh, this is just normal, I just had a baby, bring those things up to your doctor. Never be afraid to reach out and bring those things up.
I absolutely second that because also don't be afraid to advocate for yourself because a lot of those physical symptoms that are happening, we need to do a lot of investigation around those to make sure that they're not physical issues that are happening, like that you're not having headaches because you have preeclampsia, or you're not having low back pain because actually had an injury from an epidural, or have a disc that's out of place. Like, so we should investigate that. So depression, anxiety, OCD, those are diagnoses of exclusion. So I just want to put that point in there because we don't want to we don't want to miss something very serious that's happening because you're thinking, well, maybe I'm just depressed. No, if you're having physical symptoms, those always need to be brought up. And I love that Andrea talked about, those somatic symptoms, particularly in women or birthing people of color. 1 in 3, as many as 1 in 3, will suffer from a perinatal mood and anxiety disorder. So it's really important to note those somatic symptoms, but also to rule out that there are that there are not other complications going on.
Absolutely.
Absolutely. And I think that that just brings up such another point of it's so difficult for women and birthing people afterwards of you're having these physical pains. There's so many changes to your body. How, can you discern the different things that are going on? That's confusing in itself. And then having to, take that advocacy on as yourself. But I saw in the chat another comment of, yes, advocate. That's such an important part of this. But it can, recognizing that can be really difficult and exhausting too as a new mother and a new parent. Um, I'd love to hear from each of you if someone's experiencing these things that you've mentioned, or someone close to someone who just had a baby notices these. What would you suggest a good first step would be? I know, Dr. Joy, you had mentioned screening. What are some other steps that folks can take if they're feeling like, something's not right?
I think one of the most important things is to realize that who is in your village, right? That certainly would include your doctor, your OBGYN. Other physicians are also trained to be able to screen these and make appropriate referrals for you. So if your OBGYN, if your relationship is not, the best with them, but you have a good PCP, talk to your PCP. You're going to the pediatrician with the baby, usually, more than you go to the doctor for yourself in the first year of the child's life, right? And so the pediatrician can be somebody. But if you feel like none of those folks are trustworthy enough or nobody can understand what you're going through, there are resources out here for people that you can get immediate help. So the National Maternal Mental Health Hotline, the number is 1-833-TLC-MAMA. 24/7, there's somebody there. Those are all licensed and trained clinicians on that line. Over 60 languages are spoken. And you don't have to be the person going through the postpartum experience as a birthing person. You can be a family member or close to a loved one or a friend that you're concerned about, someone you can call. PSI, Postpartum Support International, where I work, we have over 30 support groups. And so there are folks, and they're all free, they're all virtual. There are folks who have walked through this experience. All of those support groups are led by folks who have lived experience. But there are a multitude of ways that you can reach out for help. Even if you're not sure, you feel like if I reach out to somebody I know, I'm going to feel judged or shamed for expressing what it is that I'm going through. Use one of these resources where we don't have to have your name. We don't have to have like this close personal relationship with you, but this hotline is here because we have people who are concerned and want you to know that you're not alone and who are trained to be able to help you.
I'm so grateful that you brought up PSI. There's PSI, Shades of Blue. There are lots of organizations that are out there that offer opportunities for help. And I talk to my support persons all the time. So dads, moms, partners. And I say, this is the time when it's really okay to be a snitch. So I love it. I absolutely love it when I get phone calls from dads or from grandmas that are saying, hey, she's not doing well. I recently had a patient's mom call me and just say, I know she's coming there today. I know, that she has not been doing well. I'm keeping the baby every night because I'm worried about her being home alone with the baby. I love that because that gives me an opportunity to really delve deep because, while we talk about screening tools, we have many validated screening tools that can be used, but people also know how to trick those. If you know what answers, especially in my clinic, because they're going to be screened at least 3 times. And if they have a positive screen, they're going to be screened, 4, 5, 6, maybe even 8 times every time they come. So, if they really don't feel like being bothered with me and they don't want to hear about it, they'll just pick answers that make their screen look less positive. So we should still be checking in with each other. There's nothing like the human touch and that connection to say, hey, how are you doing? I noticed that you're a little irritable. I noticed that you don't seem to be sleeping well. I noticed that you're not doing your makeup and your hair like you normally would. And some of that is just being tired and having a new baby, but some of that can also be that I'm just not feeling like myself. And that's a great question to ask. Have you been feeling like yourself? So even in folks who might not have a positive screen that we give them online or on a piece of paper, it's still important to check in with that individual just to see, like, how are you feeling? And are there any supports that we can offer? How do we help you engage your support network? Like if you're not sleeping, sleep is so important when it comes to mental health. And if you're not sleeping, you're not eating well, you're not able to take care of yourself, that is a recipe for some serious depression and anxiety. So I think that those are just kind of important points, just checking in with your village and being able to put them together. I absolutely love Postpartum Support International, or PSI, because they have support groups for any and everybody. They have support groups in other languages. They have support groups for the partners. They have a dad support group. They have support groups for folks who have lost a baby. So many different opportunities to engage with other folks who are walking that path with you, and with licensed therapists who can help guide you.
Thank you both. We put that link for Postpartum Support International in the chat, along with a few others. We'll be sure to include those in the follow-up materials. I know people have been asking. That will all be sent out afterwards to you, as well as our MHA screen for postpartum depression that will be included. So thank you everyone too for including different resources that you might be aware of or have used before in the chat. That's really helpful. I'd like to move our discussion into, for now say someone's kind of identified, okay, I'm struggling. Now where do I go? What does that diagnosis process look like? I'd love if you could kind of talk us through, what does the diagnosis process for perinatal or postpartum depression typically involve? Who should parents turn to for this diagnosis and treatment?
Yeah, so a diagnosis usually starts with a screening, like Dr. Joy mentioned in her clinic. Your clinician, your doctor, nurses, whoever's trained in your immediate the care setting, will usually do a screening, and that involves asking you some questions about your mood, how you're feeling. These questions that are use screening tools that use questions that are pulled from the DSM-5, that kind of run through in a very rudimentary way what are some of the symptoms of depression, right? And then they might ask you how long you've been feeling this way, right? Because that gives us a better understanding of whether or not this was with the onset of your pregnancy, or you may have people who struggle with depression and anxiety are at a higher likelihood of experiencing peripartum mood disorders, right? So if you know that you've been diagnosed with clinical depression or anxiety prior to getting pregnant, you are more likely to experience depression during or following the delivery. And so as you're coming in for your regular checkups with your doctor during pregnancy, the screening, they'll ask you those screening questions. Then you should be referred by your OBGYN or your other care provider for a more thorough evaluation with a clinical mental health therapist. And so that would involve, again, you're going to do some of those screening questions. Sometimes the the tools that they use to do that are tools that are used to screen depression in other settings, but there is one called the Edinburgh survey that asks specific questions about your mood and behaviors since becoming pregnant and or delivering, right? And so usually your clinical, sometimes they do that in the OBGYN in office, like in the OB's office, they might do that screening tool with you, but they'll refer you to somebody who can do a more thorough evaluation and then come up with a plan for caring for your mental health as you move through the pregnancy and through that first year postpartum or thereafter.
Yes, I absolutely agree. And I have to say this, and yes, I am an OBGYN and I love OBGYN and all that. But honestly, as I move through a lot of these circles, I find that screening doesn't just automatically occur many times in the setting of OB care, especially in under-resourced settings like where I work. And I think that part of the issue is that just there's a scarcity of mental health providers all over the country. And it's like, okay, I'm here in my busy clinic trying to see 20 plus people in a day, and I get a positive screen. Well, what do I do about that? I don't really feel comfortable prescribing meds or doing any sort of therapy. How do I handle that? And so that's why it's so important for us to share resources around so that people know what to do. In Georgia, where I am, we actually have what's called Peace for Moms, and I'll put it in the chat, but it's really a unique program where as a clinician, I can call up and get help with how do I handle this particular person who's in front of me that's needing help? How do I get them referred to the right resources? Maybe I need a psychiatrist because they have pre-existing mental health conditions and they're on a lot of medications, and I'm not really sure how to manage those during the pregnancy. Which, by the way, let me just be clear about this. If you have been placed on medications and you have been well controlled on those medications, pregnancy is not a reason to stop them. There are very few medications that we actually have to stop in pregnancy. And I can really only think of one off the top of my head. And it's so important to get the message across to people that if you have been diagnosed with a mental health condition and you need medication, it's important to have that medication, even during the pregnancy and postpartum period where you might be breastfeeding. And that is because mental illness in pregnancy is actually more dangerous than any medication that we have that we treat patients with, whether, from schizophrenia to depression to anxiety, OCD. If we're going to expose the baby to something, I would much rather expose them to a medicated, stable mom than to a mental health condition where that mom may not be able to make her appointments on a regular basis. Maybe she's not eating well. She's not taking care of herself well. Maybe she has bipolar disorder and is doing things that might be dangerous. So we have to think about it from the standpoint of mental stability, right? But also from physical stability. Did you know that depression, anxiety, and pregnancy runs up your cortisol levels? And it actually starts this cascade of increased risk of hypertension, diabetes, low birth weight. So there's not a single medication on the market that does that, right? But depression and anxiety over a sustained period of time will do that. So I always say, don't, and if you need the treatment, have the treatment, and have treatment that's efficacious, meaning that it's working. So if I have people come to my office all the time who are on Zoloft 25 milligrams, which is not treating anybody, right? But now you have a baby that's exposed not only to the Zoloft, but to the mental illness as well because it's untreated. So taking what you need and having a plan of follow-up with your doctor or psychiatrist, or if your family member is going through a pregnancy where they need treatment for mental health, please advocate for them to be treated. Let's not have people suffering throughout an entire pregnancy and then trying to do the postpartum period, especially the newborn period of that first 6 months, without appropriate treatment. So I'm sorry, I'll get off my soapbox now about that.
Oh, that's really good. I just wanted to mention something. Thank you, Dr. Joy, because sometimes because I live in the bubble, right? Because I'm in the mental health world. And so I'm like, oh, there are a lot of us out here doing the work, right? And when you take a broad look and you step back out, it's kind of like, oh, we're scattered all over the place, right? But one of the resources, both for our for parents or family members and for our clinicians who are trying to look and make connections with people in their for people in their area. PSI also on our website, we have a provider directory, and you can limit the search by area, but also if you are more comfortable you want to talk to a therapist who's a therapist of color, like that's a preference. There's a way for you to limit the search in that way. Um, and we also have a program where we have support coordinators in most of our states and local communities that are able to, their job is to find resources and to have resources at the ready for people when they call our warm line, which you can find. The warm line is on our webpage at postpartum.net. That's our, not the hotline, not the maternal mental health hotline. It is our helpline at PSI. Someone will get back to you within 24 to 48 hours, and they can get you to local resources, right? Someone will walk you through that as well. But you are right, like there is a dearth of mental health professionals, and it is difficult to find mental health professionals who have this certain expertise as well. But that's why we have that resource available for folks on the PSI website as well.
Thank you for that resource, Andrea, and for that information from each of you. I want to uplift one of the questions from the chat that is integrated into what you're saying about our clinicians. Someone had asked, as a psychotherapist on an inpatient psychiatric unit, what resources are there for our residents, attendings, technicians to teach them to be more vested in recognizing these symptoms? They're often overlooked and not seen in postpartum moms. So I know, Dr. Joy, you had mentioned something available in your state, in your community, but are there any other resources just at this time that you want to share for our clinicians who are on the call?
I think that we are starting to recognize this a lot more. When I was a trainee back, well, we won't say how long ago that was, but I remember there being one lecture on depression and anxiety during pregnancy and in the postpartum period, right? So it's many times people do not get great education about how to handle this. And I will say that Postpartum Support International has done a wonderful job curating a training program. So you can go, regardless of what your role is in the care of that parent, you can go and get training. They even offer monthly groups where you can talk about really difficult patients that you can shoot out and say, hey, I've got this mom who is really, really struggling, and here are the things, and you can get advice from other clinicians as well. So that's a national program. If you are a prescriber and you take the course to get the PSI certification, you also get a special pharmacotherapy class that teaches you how to use medications in pregnancy effectively. So that's all been great. I do think that it needs to become more mainstream, and that we should be talking more about this. The American College of OBGYNs does recommend that we're screening at least 2 to 3 times during the pregnancy. But again, a lot of folks are really nervous about what to do. They get that positive screen and they don't really know a whole lot about treatment opportunities, about their local resources for therapy, et cetera. So I think we've got to sort of collate all of the resources so that people are able to easily access those. And when I say people, I guess I'm meaning clinicians. But there also has to be some intellectual curiosity, right? Because I found out about the certification because I was looking for something. Like I knew that I was not well versed in this, and I knew that I was not being able to help my patients. And so I said, okay, well, what's there for me to do? And that advanced pharmacotherapy training was great. I went and spent time with a group of psychiatrists that only took care of people who were trying to conceive, pregnant, or postpartum. That was amazing. And now I feel very confident, in taking care of moms who need pharmacotherapy. But I think that we really do need to sort of continue to promote that message and ask your clinician. I think I might be, if I have a problem with depression or anxiety or any other mental illness, what are the resources available through to me as a birthing person? Because when you start asking questions like that, people start looking around like, okay, well, what resources are really out there? And am I doing the screening? It's okay to say, hey, am I going to be screened for a mood or anxiety disorder during my visit when you come, to a visit? There's nothing wrong with that. But it sort of just advocates for yourself in a very subtle way to say, hey, I need to make sure that everything's okay with me. And I want to have an opportunity to talk about these things with you, as my care provider.
Absolutely. Thank you. Um, I'd like to move into talking about some of the treatment options that are available. Hearing from each of you, what are some of those effective options for people experiencing this that might be both medical or non-medical?
Mm-hmm. So one of the most highly regarded and well-used therapeutic approaches for postpartum depression is what is called cognitive behavioral therapy. And usually this is found to be effective because it is an behavioral activation, behavioral thinking about the behaviors and the thoughts before they come, finding out what is leading to those thoughts, and then actually I always frame it with my clients like catching the thought and being able to examine the thought and make a different choice about what the circumstance. And so usually most cognitive behavioral therapists, that it's a 12 to 16 week kind of course. And so this is something that is usually seen as an evidence-based and really effective treatment for postpartum depression, because postpartum depression is not an extremely usually not a long term, right? It can have serious consequences in the short term, but it usually doesn't, it's usually not long term. And so usually that course of treatment is something that has been used to treat postpartum depression. If you do not want to see a therapist, or you're still trying to decide, one of the other things that has been proven to be really effective is peer support. And so again, I will wave the PSI flag all day, because that's what those support groups are, right? They are an opportunity they're not a therapeutic group, right? So they're not there, you're not getting group therapy, but you are getting group support. And so you are being led by someone who may or may not be a clinician. They are very, very well trained volunteers, most of them. Some of them are employees at PSI, but everybody has lived experience. And so being accompanied through the journey, knowing that you're not by yourself, hearing what other people have been through, hearing what other people are going through, hearing how they're overcoming or what they're doing, right? That sense of not being alone, and not allowing for yourself to be isolated because you feel like people don't understand or will judge you, when you're in the company of people who understand or can relate because of their own lived experience, that's been proven to be very helpful. If you're not ready to do that in a group setting, PSI also has what we call a peer mentor program, where you're matched one-on-one with someone who also has lived experience, is also very well trained. Some of our employees are peer mentors. Most of our peer mentors are volunteers, but they check in with you in the way that you all agree to check in at least once a week. And they're there to accompany you through the journey just so that you don't feel so isolated and feel so alone.
Yeah, I think that's really, really important. A big part of dealing with perinatal mood and anxiety disorders is having adequate support. I mean, it's absolutely huge. So I love the idea of my patients being partnered with someone who has lived this before and can just give them encouragement and talk to them about ideas for coping mechanisms, et cetera. I think those are very important, and I love just putting people together. Sometimes it's a very low tech thing, but it makes a huge difference. And then the other thing, like we've been kind of harping and talking a lot about screening. Um, there have been studies that found that just screening people and putting a name to what they're feeling actually helps improve outcomes by about 9%. That's with no therapy, no medication, just naming it and helping me understand where I am and what I'm going through. So I think that we have so much opportunity to promote this wherever we are, because everywhere we are, there are parents, right? People who are going through that. And the Surgeon General just recently came out, I think it was in September, and talked about the stress that parents are under and how important it is to offer support to parents. And so you can do that as a layperson, you can do that as a clinician, you can do that as a mental health professional. Um, I think that we just have to really take the time to notice those people that we're connected to and to ask those questions of our folks who are our parents, especially those who, have recently become parents.
Mm-hmm.
Absolutely. Thank you both for those. And I know there's been a lot of questions in the chat, and just as we've talked about um, the lens of medication as a treatment for different mental health conditions, and people questioning of, I know a few people had shared their stories in the chat of just feeling as though they weren't heard in their treatment by their doctor, of really needing to continue on their own medications for maybe a condition that they have been experiencing prior to their pregnancy and continuing after. And then now we have some new medications for specifically for postpartum depression. Is there anything else that you can share with our audience just about the safety of these and maybe how to advocate with doctors to ensure that you're able to continue your treatment in safe ways?
I think that this should always be a shared decision-making conversation, that we should talk about risks and benefits and alternatives as well. I encourage all my patients, if you have been treated in the past and you are stable on your meds, to continue those meds. As a matter of fact, the perinatologist, which is a high risk OB specialist, recently called me about a patient that I was changing meds in because she was on one of those meds that we worry about in pregnancy for her bipolar disorder. And she called me and she said, "This patient is stable, leave her alone." So I was like, okay. And so we actually left her, and we increased our ultrasound schedule so we could keep an eye on the things that I was concerned about, but we left her on that medication and she actually did extremely well. And so I think that there's a lot of fear mongering about medication use in pregnancy. And we completely missed the bus with that because, again, the mental health issue itself is a risk. So we really want to sort of mitigate that risk. And like I said, and I'll reiterate, there is no drug on the market that we use for mental health that is worse than allowing someone to have those sustained high stress levels, and those high cortisol levels just set off a whole cascade. They actually deregulate the pituitary axis that is providing hormones for that pregnancy. And so that's why we see things like preterm birth, like preeclampsia, like diabetes, like low birth weight. So we really need to advocate for ourselves, and you need to be heard when you're in with your clinician. I'm
Yes.
sorry, y'all. My office is across some train tracks. But you need to be heard. And if you're saying, I really think I need to get back on my meds, or I need to continue my meds, hopefully the person in front of you who's taking care of you is willing to have a very open conversation about that. And if they're not, you might want to think about, is this where I really want to be receiving my care?
Here, here, Dr. Joy. I'm glad you said it. I wanted it to come from the OBGYN because I really do. And I know how hard this can be, right? As a pregnant person, you are in you can be you're in a you can be considered vulnerable, right? And so one of the recommendations that I always make, and I was a hospital chaplain for several years before I switched and started working for PSI, is to always have somebody you trust with you at your appointments, in the room with you. Sometimes you feel like in the midst of all that the doctor is sharing with you, all the medical professionals sharing or asking of you, that you may not hear everything that they say, but you also may feel like they're not hearing you. And so who is a person that can be there to be a support person and help you to advocate? If the person who is in charge of your care is not listening to how you need to be cared for, not answering those questions, then what support do you need to find a provider who's going to do that, right? The ultimate goal is not just for you to deliver a healthy baby, but also for you to be healthy following the delivery of that baby and during the pregnancy. And so there should not be, I saw someone ask a question about stress. One of the things that stresses you out during this process, it should not be your care provider, right? That should not be an additional source of your stress. And so, whatever help you need in order to be able to advocate for yourself, whether that's, I don't feel like I can do it, but I know if I bring my sister, she's going to say the things that need to be said, and I'm going to give her the permission to be able to be in the room to say those things, then do that. But your provider should not be a source of stress for you during this time.
And I will make a shameless plug as well for birthing support, pregnancy and birthing support with doulas. I am
Doula.
incredibly lucky that where I work has a doula program that's free. So every single one of my patients can have a doula if they want one. And so we are able to have great conversations. And the doulas are fantastic at elevating the patient voice and just saying, hey, I, I know you had questions about X, Y, and Z. Can you talk to the provider about that? So I think that is an amazing thing. If you have the resources to have a doula, I think that's someone who can really help advocate for you. But again, don't feel like you're being too pushy or too much. If you know that there is a problem that you need to have addressed, there is no keep asking the questions until you get some answers. Whether that means that you have to sort of have a heart to heart with your clinician, or if you have to find a new clinician, it's just really important. These things are too important. Realize that when we have a parent that has depression, anxiety, or perinatal mood and anxiety disorder during that first 6 months of life, that is when you're forming your attachment to your baby, and your baby is forming attachments to you, and starting to determine how that child will relate to other people. If you cannot be present mentally, physically, emotionally, there will be an effect. And that's not to shame anyone who suffered throughout that first year, that first 6 months without help. because you did the best you can with what you had. But it's really important that we start moving towards thriving and not just barely surviving, because it really does make a difference for our children, for our families, for how we're able to do financially, our productivity. I mean, it's mental health is so huge. And I think we often miss the boat on that because we're also focused on, okay, is the mom healthy? Is she, bleeding too much, or does she have really high blood pressures? No, but maybe she does have a perinatal mood and anxiety disorder. And a perinatal mood and anxiety disorder is the most common complication of pregnancy. So that's why it's so important that we're looking for it, just like we're screening for high blood pressure or protein in the urine. We've got to be screening for that as well.
Absolutely. Thank you. And a lot of these different pieces of the puzzle that you're talking about is having that clinician you trust. Maybe it's a doula added in there. These are all parts of that system of support for birthing people. And I would love to hear from you on, why is it crucial for new parents to have that strong support system, and what should be included within that support system? Who can they go to for this support emotionally, physically?
I think it's important because being a parent, and we say new parent, but this could be your fifth child, right? This is the first time that you've been the mother or the father or the parent of five people, right? And so it's important because regardless of what we're made to think, being a parent is a hard job, right? And there's this cultural kind of expectation that we don't always talk about, especially if you're the person who gave birth, that you are supposed to be happy, you're supposed to be pulled together, you're supposed to be able to hold the household together, and you're supposed to be able to do all of these things with a smile on your face. And this is a period of time after having a baby, that you're supposed to be happy, right? And so to have a support system in place that understands that that's not always going to be the case, that it's okay, that lets you know it's okay for you sometimes to leave the baby with somebody who you trust and go take a nap, or to go have a shower, or to make sure that in those areas where you feel overwhelmed and unable to care for yourself, like if you need somebody to cook meals, or you need somebody to help clean, or you need somebody to do the laundry, like it's okay for you to ask for that help. The cultural kind of myth that we're supposed to, once we have a child, that we're supposed to do all and be everything for everyone is just that, it's a myth. And it's a thing that detracts just from what Dr. Joy was saying, like our thriving, because that additional pressure that we put on ourselves can also, if you're experiencing some of these symptoms of depression, can worsen those symptoms as well, right? And so those people should be people who will reach out and help you without judgment. It might be your spouse, it might be your partner, it may be folks from your faith community, it might be family, it might not be family. Sometimes the family, listen, the family is not always the people that you want around all the time. And so it might not be them. And for you to know that's okay too. It could be, work friends, it could be your friends, but it could be your therapist, counselor. A lot of doulas work not just during the pregnancy and the immediate, but they're postpartum doulas as well. That part of their job is to support the family and continue that advocacy piece and to help connect you to resources, right? And so the village can be as big or as small as you want, but there have to be people who you trust, that you're able to be your real self with, and to really be able to tell how you're feeling, and to be okay with allowing for them to help you.
I would certainly agree. One of the things that I like to stress to folks that I'm caring for is engage your network. We need a plan of, for those first, especially those first 2 to 4 weeks after delivery. Who's going to be helping with some of the things in your household? Can you have a grandparent come and stay for the first couple of weeks? People love when you have a baby, right? They all want to come, they want to snuggle with the baby, they want to see the baby, they want to. Well, if you're on your way over here, can you pick up some dinner? Are you able to do a load of laundry for me while you're visiting with the baby? Think about those things. I have a really dear group of OBGYN friends that I trained with that we're called the sorority. And we have such a good time together. But one thing that we did for each other as folks were having their babies was we had postpartum parties. We didn't really do baby showers, but we came over just absolutely locked and loaded with diapers, with meals that can be frozen, like casseroles and soups and things. We came through, we cleaned the entire house, we organized baby's room or closet or whatever mom wanted us to organize. And one person was responsible for taking the mom out to get a pedicure or a massage or something. And when she came home, the house was clean and organized, the baby was fine. And that was really just an opportunity for her to get out. So plan a postpartum party. I'm a real big fan of those. And maybe plan one monthly for the first 6 months because people want to be, I believe that for the most part, people want to be supportive of us, but we have to use our words and be able to talk about what exactly it is we need. And who in your family would say, oh no, I can't pick up, a chicken pot pie from KFC on my way over? Of course they would do that for you, but we have to learn to start thinking about how to engage our network in a useful and meaningful way. But what I see a lot of moms trying to do is, oh, so and so is coming over. Let me see if I can clean up real fast or make something for them to eat. And so we kind of get into this role of we got to care for them. No, it's time for them to care for us. I'll always say this is your time where you get to be in princess mode, right? So this is the time of your recovery. This is the time when your hormones are doing all sorts of crazy stuff. So we need to be able to really rally the troops and bring them around to hold the mama. I love that thing going around social media that's like hold the mama. Everybody's always holding the baby. Hold the mama so that she can hold the baby.
That's absolutely right. It's just so important. And for us to let go of that guilt and that dominant cultural narratives that says for us to be taken care of, it says something about our effectiveness as parents, as moms. No, model for your child, even from the very beginning. It is of their importance. It says something to me about my importance, that I am willing to take care of myself. If it's important enough for me to be around, to care for this child, to watch this baby grow up, then I have got to be able to take care of myself. I am important too, and there's nothing selfish about that.
Absolutely. Thank you both. Thank you for those words. I know they resonated with a lot of folks here. And it just feels like a really good and safe space right now. So thank you for creating that for us. I know we're almost at the end of our time. I did want to squeeze in one question that we had from one of our audience members that I think is a really important question and one that a lot of moms might be considering. Someone had asked, at what point do we rule out postpartum depression and consider regular depression? I'm 11 months postpartum and experiencing many of these symptoms. I think that can be a confusing time for moms.
One of the things that I did during COVID when we were all trapped inside was I started a YouTube channel called Delivering Joy MD. And I actually, on that channel, there's a video of a mom who told her story. And she was 13 months out from delivery and really suffering. And so I think that while we have to have some sort of parameters on things to help us guide the diagnosis and so that we have some sort of diagnosis code, right? I don't think that there's any actual time that we would say, okay, this is a cutoff. If you have never had depression, anxiety, or any other mental health conditions prior to pregnancy, and you develop that after delivery, then certainly we would call it postpartum depression. But then once we sort of stray outside of that, say 12 to 18 months, that might be what we call major depressive disorder. And the thing that we don't talk about a lot is that many times mental illnesses sort of manifest during those childbearing years, right? So from like 18 to 30, you're starting to see folks who maybe had risk for schizophrenia, and then you actually see the manifestations of those symptoms. So we got to think about that too as well. And one more point, because I know we're going to go. There is a new medication out that I'm actually talking to a lot of doctors about for postpartum depression called Zurzuvae. And Zurzuvae is something I've been using in practice for about 6 months now. It works really, really well. And so if you are someone, especially someone who's already been being treated, and you find that, okay, now it seems like my treatment is not working anymore postpartum, that might be something to mention to your clinician because it's pretty new and a lot of people don't know about it yet. But it actually helps with some of the hormonal changes that we go through after delivery, and people can get relief of symptoms as quickly as 3 to 5 days after starting it. And it's a finite medication that's used for only 14 days. So it's not a long-term medication. So just wanted to mention that because that is a little pearl that you can take to the doctor with you and say, hey, have you heard of this? Do you think I'm a good candidate for this?
Absolutely. Thank you, Dr. Joy, for mentioning that. There is a lot of new research being put into this important area that hasn't before. You know, it's so important to take care of our mothers and birthing people before, during, and after. And you're right, that timeline looks different for everyone, and it can be hard to know. But I love your piece of advocating for yourself, asking your doctor about these different things, asking about screening, about what type of treatment options are available to you. It's so important. And I know we're right at the end of our hour. I just want to give a huge thank you to you, Andrea and Dr. Joy, for joining us, for all of the insight, knowledge you've been able to share with our audience. And I want to thank the audience for sharing so openly and honestly in our chat, sharing your experiences, the resources that have helped you, and for being here today to listen. I know there were some questions about, will this recording be available afterwards? I want to share it with some folks in my life. Absolutely. We'll get the recording up by the end of the week. We'll send it out to you along with all of the resources from PSI, from MHA, from all the organizations that are really great that we've talked about today. And we'll make sure that you have that in your hands so that you have it for yourself and for others in your life. I just want to give one last huge thank you to Andrea, Dr. Joy, and Sage Biogen for helping make today possible. We will be in touch within the next week with all these resources and hope to see you back here soon for more learning opportunities with MHA. But thank you all. Have a wonderful rest of your afternoon and take care of yourself.
Thank you.
Thank you.
Thank you both.